Hello, my name is Paula J. Caplan, and I want to tell you about the harm done to many people as a result of their being given a psychiatric diagnosis, and about how those who have the power to prevent and redress such harm have done nothing but respond in the coldest of ways. Then I will tell you where to find out how every one of you can help. In the weeks after this video is posted, you'll be able to see videos of people who were so harmed in this way that they filed complaints against the powers that be, only to have their shattering stories ignored and their complaints summarily dismissed. If you believe that psychiatric diagnosis can be helpful, then I hope you'll keep watching, because my purpose is not to challenge you about that. It's just to ask you to think for these few minutes about those who have been harmed, and there are so many. Many people assume the process of creating psychiatric diagnosis is regulated, overseen by something like the Food and Drug Administration, but it's totally unregulated. I'm a clinical and research psychologist with a specialty in research methods, and for decades I've done social justice work. I graduated from Radcliffe College, Harvard University, and then I received my PhD. I was a licensed psychologist in Ontario when I lived in Toronto, and I was an ethics consultant to the licensing body there. I'm currently licensed in Massachusetts. There are two major books that are used for giving people psychiatric diagnoses. The one I talk about here is called The Therapist Bible, officially the Diagnostic and Statistical Manual of Mental Disorders, and it looks impressive. The current edition has earned more than $100 million for its publisher, the American Psychiatric Association, APA. The APA is a lobby group whose primary concern is not the welfare of people who seek help from the mental health system. Its primary concerns are the influence and income of its members and the APA itself. I used to teach my graduate students that the DSM was solidly scientific because that's what I believed. But starting in 1988, I served for 2 years on committees preparing the 4th edition of the manual. Then I resigned. During those 2 years, I saw high-quality research ignored if it didn't support what the most influential DSM people wanted, and I saw junk science cited as though it was scientific if that advanced their aims. I saw those in charge continually fail to acknowledge any of that or to try to prevent harm, although I had given them many cases of people whose lives had been damaged because they received DSM labels. The DSM people and APA officials continued then, and they continue now, to portray diagnosis as scientific, helpful, and harmless. I had begun to hear stories of people who, even if given what might seem like a mild label, were nevertheless now classified as mentally disordered and therefore had lost custody of their children, lost jobs, lost their health insurance, lost the right to make decisions about their medical and legal affairs, and more. And since there's a huge vacuum left where good science ought to be, into that vacuum sweep every kind of bias, including sexism, racism, ageism, classism, and homophobia. I couldn't uphold my ethical responsibilities as a clinician or a researcher if I remained part of the DSM work, so I resigned. Those who wrote the manual could have used scientific rigor and tried to prevent harm, but they didn't. And everyone who's been a president or a member of the board of trustees of the APA either has known or ought to have known that the manual is not scientific, doesn't improve outcome, I know that's surprising, and carries enormous risks of harm. Every one of these people could have told professionals and the public the truth. But in the past quarter of a century, only one of them has done so, many years ago. The rest have either done nothing or perpetuated the cover-ups. Of course, to do otherwise would risk losing those huge profits and all that status. The harm as a result of the current edition will continue until the 2013 edition appears in the spring, and that edition will apparently retain an enormous amount of the unscientific and harmful content from the current edition, and still more unscientific and harmful content will be added. What could be done? We learned that the APA has ethical rules all of its members are supposed to follow. These include putting patients' welfare above all else and taking account of the science, the good science. In late June and early July 2012, 9 of us filed complaints with the APA Ethics Department. 7 filed because they were harmed by getting a diagnosis, and an 8th filed because a loved one died as a result of being diagnosed. I filed an interested party complaint after decades of calling in vain for any DSM or APA official vigorously to educate the public about the unscientific nature of the manuals and to redress the harm and prevent future harm. People who've been diagnosed have suffered the most. Others who have suffered include their loved ones and a whole country, in fact, many countries, as the DSM has gone global, who are too much consumed with calling every kind of suffering mental disorder, with all of the damaging consequences and almost nothing helpful to follow from that. There's a troubling rush to call everyone who's been devastated by war mentally ill. To find it shattering to be exposed to war and then try to readjust after returning home is deeply human. And we add to their suffering when we tell them that because they're not over it by now, they're mentally disordered. Many deeply caring psychiatrists and other helping professionals want to reduce human suffering, and they're devastated when they discover that their training, which revolves largely around the DSM, does not give them a scientific foundation to understand and alleviate that suffering. Many feel trapped in a system that does so much damage. For more than 2 decades, I've listened to the tragic stories of people whose lives were destroyed because the truth about the DSM is so much hidden and because it's unregulated. People come to me asking, don't these psychiatrists care about the damage they do? Since they know the truth about their work and its consequences, why haven't they told us about it? Why no public education campaign like there is about the negative effects of drugs? Why aren't they, like the drug companies, required to keep records of and publicly report the harm, redress past harm, and reduce it in the future? I can only answer, the people with all that power have chosen not to do what you ask. Why? I wish I knew. Those with whom I worked on the complaints, some people call us the DSM-9, found their voices and bravely asked the APA Ethics Department to consider their pleas. They had turned to the mental health system in the first place because they were suffering and reasonably expected help. Instead, their lives were in many ways destroyed, some forever. Others had intended to file complaints but became too afraid to continue. So damaging had the DSM system been to them, and they rightly feared retribution. Some who filed complaints struggled mightily when writing their stories because it had been horrific to recall the calamities that resulted from getting DSM labels. But even they found that having the chance to speak the truth and ask that those who were the first cause of the harm done to them finally be held accountable had been the first good thing to come from their nightmarish times. Like them, I hope the APA Ethics Department would take steps to repair what's been damaged and prevent future harm. For months after the complaints were filed, the APA seemed to try harder to find ways to dismiss the complaints than to consider their merits or redress the harm. They ignored our request that they tell us the names of their ethics committee members. On October 22, 2012, the APA Ethics Committee, no names in the signature, summarily dismissed all the complaints, giving inadequate and even patently absurd reasons. I've written about some of this, and you can see it if you Google my name, Paula Caplan, C-A-P-L-A-N, and either Psychology Today or Mad in America, all one word. I'll write more about this soon, both there and on the website called psychdiagnosis.weebly.com. They dismissed the complaints, but the APA could nevertheless take some actions we requested. One example, hold public hearings about the harm from diagnosis and seek ways to prevent it. But they would need to care enough to do so. Please watch for the other complainants' videos to be posted here. To get on the email list for announcements when more go up, please write through the contact form at psychdiagnosis.weebly.com and watch that site for the many ways that you can help and for further actions that we have planned to stop the harm. Join us to end the suffering that so many endure in silence and alone. Thank you.